Tuberculosis TB is an infection. It's caused by a bacteria, a germ, that is spread in the air.
TB is passed on when someone who doesn't have TB breathes in the TB bacteria from someone who already has active TB disease in the lungs.
It can cause a serious infection in the lungs in about 70% of patients, but it can actually even spread beyond the lungs to any other part of the body.
So there is two different types of TB. You have what we call active TB disease and latent TB infection. Active TB disease is when you are actually unwell with TB and you are showing signs and symptoms. With latent TB infection, we also call it sleeping TB because the infection is dormant in your body.
The typical symptoms are in your lungs, so we say a cough that lasts for more than 3 weeks. If you might produce a bit of phlegm. And then you get symptoms outside of the lungs which are very non-specific but important, like slow weight loss, loss of energy, pallor, sweats, low-grade fever.
So the TB control program is located here at the Anita Clayton Centre in the city. We manage all cases of active and latent TB in Western Australia. That is looking after the patient diagnosis, treatment and providing medication and what we call case management as well.
The key test that tells you they might have TB is a chest x-ray which shows a shadow in the lungs, and then a phlegm test or a sputum test where we grow the bug and that proves the infection.
Once you've been diagnosed with TB, treatment is then offered at that point in time. The doctor will discuss with you various options for what treatment may be suitable for you.
We have case management nurses and one of their jobs is to support the patient and then really ensure that they maintain the pills, taking them exactly as prescribed right through to the end, even once they still feel better. If they stop them early, infection can reoccur, and not just reoccur but be drug resistant and harder to treat.
TB is curable if the medication is taken every day and taken correctly.
They should not be afraid of seeking treatment. The treatment is difficult but we support them. It's free of charge and there will be no consequences in terms of their visa or their stay in Australia or ability to work and so forth.
So it's really important if you're told you have TB to come into the clinic and to see a doctor so that the treatment can be given because TB is curable.